Hi everyone, welcome to Kandy Times. Since parliamentary elections are just around the corner, we thought it would be a good idea for the Kandy people to know their candidates and the policies that are in place to develop Kandy. As part of our first episode, we have Dr. Hansaka Wijemuni from National People's Power Party to address our audience. Dr. Hansaka Wijemuni has received his higher education at the Ruhuna Medical University and has been a pioneer in fighting for student rights and free healthcare. He, after retiring from his government service, is now full-time at the party and is the president of the Kandy National Intellectual Organization. Welcome to Kandy Times, Dr. Hansaka, and thank you very much for accepting our invitation.
Yeah, thank you. Actually, in these days, I am in a busy schedule.
Yes.
But very good opportunity to talk with the Kandy people.
Okay, thank you very much. Without further ado, let's go straight to the discussion. And my first question to you is on tourism. As we know, tourism is the main sector to uplift our economy. Even though Kandy is considered a city where tourists visit, their stay is limited because of the less activities or fewer activities in Kandy to do. People mainly go to Alla or down south to stay long because there are many activities that they enjoy. What is the plan of the party to develop the tourism in Kandy as well as prolong the tourist stay in Kandy?
I am one of the member of Policy Development Committee of the NPP. We have National Policy Development Program, and we have special action plan for the Kandy, especially in tourism. Main problem of the tourism in Kandy is we have no clear icon and no clear identity. That's a problem. The tourist who stay in Kandy just 1 or 2 days. I think this our environment and our natural beauty is not marketed.
Yes.
In last several years, especially in last 2 decades. So we have to improve that area. I think we can contribute to our economy in a very significant level in Kandy tourism.
Thank you, Doctor, for that. My next question to you is, the many youth, once they finish their education here in Kandy, their only option is either to migrate overseas or to go to Colombo looking for better opportunities. How do you plan on developing Kandy to boost the economy, the local economy, and get job opportunities here in Kandy for the youth in Kandy?
Yeah, in last 100 years, most business opportunities and most our agricultural sector and our other traditional economical sectors has not been developed. Actually, in most of the sectors are old as 100 years. When we consider export agriculture sector, sometimes they are all the agricultural practices and harvesting practices and they are traders practices all are same as 100 years. I think in last 100 years we were unable to convert the updated of that sector. So youth are not willing to practice those sectors. So they run away to the Colombo and other cities and they find easy jobs. I think a lot of opportunities in Kandy, and we can develop those sectors, especially export agriculture sector. We can improve the value added products, and we can improve that area as industry, and tourism is other opportunity. And we have lot of identical opportunities in Kandy to improve the job opportunities in Kandy. But unfortunately, last 100 years, we were not done anything for those sectors.
Exactly, that's true. See, we have to change with the times and with other countries to support that. Thank you, Doctor. The next question, Doctor, is the traffic. We know in Kandy it's famous for the traffic and the congestion and the unavailability of transport after a certain time. Like in the evening after 6 o'clock, there is less transport, public transport, especially for people living in rural areas. And I think that is one of the main issues that is hindering the development of Kandy. So, any plans to develop or change the situation, the transport situation in Kandy and address the issues?
When we consider the town area of the Kandy, actually there are many thousands of vehicles go across the Kandy city to their destination to other cities. We have to improve the bypass roads to bypass the Kandy to those vehicles. And the other thing is we plan to do some transport system to the Kandy, and then we can stop the unnecessary vehicle come to Kandy. Other thing is Kandy is a historical city. And other hand, it's a commercial city. And other hand, it's an administrative city. I think in a very limited area, we are running those three concepts altogether. But I think it's a very difficult task. So we have to remove some officers and some places from away. We have to remove that office from Kandy city. I think most important part is we can improve the Kandy city as a historical city. And we have to develop the surrounding areas as commercial and commercial and administrative parts.
Right. Thank you.
And your question, other part is in the rural areas, no public transport after 6 p.m. It's a very unfortunate situation. And other thing is our rural roads are very difficult one. Some areas they were broken and damaged, and some areas actually no roads. No roads. So we are planning to improve those rural roads, and we have to ensure the public transport after 6 p.m.
I think with that, even tourism will flourish, because if they are able to go to rural areas and see the beauty of Kandy without just the city, that would support the tourism.
Actually, in last several days, I seen the very beautiful areas in the Kandy I never seen before. Actually, I am not the traditional politician, and I just came to politics, this type of politics, in last several weeks.
Okay.
But I am wonder why they don't use that areas for tourism and other things to improve our economy.
Yes, when we go to other countries, we see that Sri Lanka is a beautiful city that has a lot of resources, but has not been touched or made use of. Yes. Thank you, Doctor. Doctor, another issue I think whole of Sri Lanka is facing is deforestation, pollution, and garbage waste management. And we know in the past there were several deaths that occurred because of the waste management. And with the higher population, the waste management or garbage collection is high. How do you plan on sorting this issue and addressing it in a more sustainable way and eco-friendly way?
We have definitely we have plan, and we mentioned in our policy planning documents. Uh, we think actually garbage is a very good resource for electricity and fertilizers and other things. Unfortunately, we miss that opportunity. So we plan to develop some industries using that garbages. And other thing is the sustainable environmental protection is our one of our main policy in Kandy. Our land policy must be we have to very clearly use that lands, because in Hantan and other areas some are invade those lands in very corrupted ways.
Okay.
So our first aim is to identify those lands, and we must rearrange those lands and other things, because in political influences, lot of lands are occupied by unauthorized people.
Yeah. Okay.
So our land policy must be very tough.
Yes.
And air pollution is other things. And earlier I said that we want to remove some vehicles from the Kandy city, unnecessary vehicle. Actually, in the school time, lot of vehicle came to the Kandy city.
Yes.
In one vehicle, only one child.
Right. Yes.
So we have to identify those areas, and we have to introduce some transport system for those students.
Safety. Okay, doctor.
Yeah.
Thank you very much. Doctor, another issue that is considered a main issue in Sri Lanka is healthcare. And we see that due to the economic crisis, there were lack of medicine, and due to policies and different politicians, wrong medicine or illegal medicine has been brought to the society, and people suffer the consequences. I think this is a very prominent or important question to you as a person who has fought for free healthcare in your career. What are your plans to develop the healthcare, especially for the rural sector people, as accessing healthcare for them is a difficulty?
Yeah. Actually, healthcare is very vast subject. For me, we think that healthcare is not just giving the medicine, and not just talking about the diseases. Healthcare is a vast subject, and we think nutrition and environment and other protect from the unnecessary violence, and all the things are included to the health. Health is a vast subject, and we think our hospital system and our health system is all are outdated. All are outdated. They are not updated in last several decades. We think we can do some more things for the healthcare. Actually, using that resources, current resources, we can improve our healthcare by good management. For example, when you go to the Kandy hospital in any time, lot of people are in the floors, on the floors, and other staircases and other things. But unfortunately, some wards are empty. Bed occupancy is usually, I think, only 70%. But unfortunately, patients have no beds. For that issue, other countries has a answer for that issue by just appoint a bed manager. When we admitted to the patient, admit to patient to a ward, some ward. Bed manager decide to how they give the bed for each one.
Each person. Right.
Each person. Actually, this is a very simple management ordination. But unfortunately, in Sri Lanka, people also thinks that's okay.
Yes.
That's okay. They when we give a bed, they come to the bed. When we ask to come out the bed, they come out and lay down on the ground. It's a very unfortunate condition. And in other hand, some people came to the Kandy hospital for simple investigations. There are several days for that those things. Actually, we have a lot of peripheral hospital and peripheral healthcare units. We can provide the facilities to that units. When we consider the private sector, they have only one lab in the main city. And they just have collecting centers surrounding this area, and from using the courier service, they just deliver their samples and issues the reports. So why can't we use that system to our healthcare? So I think it is very unnecessary thing to open the lab to each hospital in the rural areas. We can very easily can collecting. We can improve the collecting centers from each hospital. That's a simple way. That's a simple way to improve the healthcare system in Kandy. Actually, we have very comprehensive plan to improve those areas, and we clearly identified in the problems in health in Kandy. Actually, lot of our ministers and our previous members of parliament try to establish very expensive projects to the Kandy, very expensive projects, but the outcome is very negative or minimum outcome. We can change lot of change lot of things in healthcare by using the simple methods.
Yes. Yeah. Thank you, Doctor. One thing that I would like to talk about is that we have heard that there are many suicides happening. So I think the mental health is a big issue in not only in Kandy but all over the world. But in your healthcare plan, is mental health also considered a crucial part?
Physical health and mental health both are very important. Actually, in mental health, in our country, frustration level is very high in each age group. It's young and other age group. All our frustration level is very high, and substance abuse is very high in Kandy than we think, because I work in Kandy cardiology unit, 14 years duration. In last 2 years, we met number of patients, actually at least 1 or 2 patients per day with heart attack. Their age group is below 30 years. The main cause is
Stress.
Main cause is called substance abuse. Substance abuse.
Okay.
Substance abuse cause to the heart attack.
Heart attack. Okay.
When we talk with them, they have mental problem also. That the main cause of that is a Kerala ganja.
Okay.
It's mostly available in Kandy. Ice also mostly available in Kandy. And this is a very unfortunate situation. So their frustration level is very high. Their unemployment and other several factors enhance that situation. But the main problem is our society has destructed in last decades. our relationships are very poor within family and with in outside. Also, our relationships are very minimum, and we all engage with equipment like our cellular phones and other things. But our human relationships are very weak. Uh, I think we must the enhance the sport facilities and other facilities of arts and dramas and other things, collective activities must be
Brought together.
enhanced. Yeah.
Yes, enhanced. Okay. Doctor, following up on your answer, you said that there is a high rate of drug abuse, substance abuse in Kandy. So I think it's within school children as well. So, and how are you planning to improve the schools, the education system, with inclusion of about well-being, about health, about mental health, about improving their skills, their relationships? How do you plan on doing that?
Actually, we want to change some areas in our plans. The mostly focus area is the education. I personally think our education system must be changed by 100%. 100%. So we focus to that target, and our policy documents all are developed on that basis, because our education is very outdated one. Outdated one. Fortunately, I am a doctor, and this education system is suit to me. But in my classmates, 99% of my classmates face very difficult in those education system. In this education systems, they just measure several qualities and several abilities of us. They just teach us and ask the question. When our answers is match for what we teach and what we write to the paper, if it is okay, we can get 100 marks. But our communication ability, our empathy, and our other abilities, our education system not measured that those areas. It's very unfortunate thing, and our education system must be changed very rapid. We must change those areas very rapidly, and I think education must be changed by 100%. And now the present education system, but we want to change by step.
Right.
Actually, those who left the school in prematurely, we must be avoided. Premature leaving the school. When someone leave the school, they must have a plan for the future.
Exactly.
Especially, we want to improve the areas to grab those students.
Yes.
And we have very clear plan to school leavers.
Right. To develop their
Yeah,
skills.
yeah.
So I think that will reduce a lot of crime rates, substance abuse, and also the mental health issues also they have of unemployment or not being satisfied, or they haven't developed any self-esteem. Yes. Yes. Doctor, my last question to you is on the crime rate. We see a lot of, especially the children, there is a lot of abuse in children, like sexual abuse and physical abuse in children, and there is a crime rate. And from the past decades, we have seen that if you have power, you get away with all of those things. So how are you planning to address that? as well as I want to ask that, if we see certain areas in Kandy like Mahayava, those areas, lot of dropouts and the crime rate is very high in those areas as well
Yeah.
because of the situation they are living in.
Yeah.
So, how do you plan on addressing these areas and developing areas such as those?
Yeah, crime areas is very high level in poor socio-economical areas. So actually, we must answer those questions. Their poor socio-economical condition must be improved.
Yeah.
Improved. Actually, when we consider the resources of the Kandy, we can easily improve those areas. Actually, very limited areas has very high crime rates, and their lifestyle and other things also bond with those crimes.
Right.
I think our several politicians and other several responsible men also responsible for that crimes, because in substances, mainly substances are very easily available in Candy City. When we go to brought some water bottle or other things, it's very easy to purchase a substance easier than a water bottle,
Water.
because very available, very easy access for that substances. In Kandy, I worked as a doctor in Peradeniya Hospital and Kandy Hospital, and I have a private practice also. I met the persons each day with high rates of the substance abuses. I never seen those amount of substance abuse patients in Colombo also. I think very high rate substance abuse, and they try to earn some money for those expenses.
Yes.
Yeah, in the crime rates also very high for those situations. Another thing is our system of the security system, like police, Sri Lanka police is not updated. They use very old methods to prevent that. They have no resources actually, and people also not trust to that system and police and other things. They try to struggle with those without help of government.
Yeah. Yes. So that's a good plan that you all are having, Doctor. That's a lot of information on how we are going to develop Kandy, and I think I have run out of questions to ask you since you have touched a lot of places. Is there anything that you would like to tell the people in Kandy?
This is a very crucial time for our country, and we each of us has a very identical job, and we have to identify what's our job on this situation. I think I sacrifice lot of things for that situation. I ask Kandy people, especially in Kandy people, to join those our campaign, for not just for the election. Actually, our very important part will come after the election, because all of us has a very clear duty for our nation. We must do it. We are the people who live in conventional period. It's a very crucial conventional period. We can change our country. We must do it. So I invite all the people in Kandy to join us for the sake of our country.
I think that is a very good message that Dr. Hansaka brought out, is that the people's duty is not only for the election, but beyond that. To develop our country, we all must come together. Thank you very much again, Doctor, and wish you all the best. for the upcoming elections and hope all your dreams can come true.
Yeah, thanks.
Thank you everyone for tuning into our channel. Please subscribe and like our videos. Stay tuned for further more candidates to come up with their policies. Thank you.